March is National Kidney Month, so we're happy to have the president of the National Kidney Foundation, Dr. Sylvia Rosas, join us to share what you need to know on kidney health. Doctor, so glad you could be here. Thank you for joining us.
Thank you, Sasha, for having me.
So tell us a little bit about what kidney disease is and how it's diagnosed and treated.
Sure. Our kidneys get rid of fluids and make sure that our electrolytes and all our minerals are in order. They also detoxify the medications. So when the kidneys don't work properly, you are unable to do those things. Your blood pressure goes up, the legs swell up. But it's very important to note that there is a lot of hope for patients with kidney disease because there's a lot of new therapies for it. Diabetes and hypertension are the most common causes of kidney disease, so it's very important to treat those diseases. But important is that if you are at risk, so those individuals that have diabetes, hypertension, a family history of kidney disease, if you have heart disease, that you are annually checked to see if you have protein in the urine. Sometimes it's protein. One type of protein is called albumin in the urine, and the other one to take a blood test for something called creatinine. And that tells us the percentage of your kidney function that is working. And that's how we diagnose kidney disease. Because, if you know your numbers, then you'll be able to treat the disease.
Got it. Now, tell us, doctor, is there someone who's particularly more at risk for kidney disease?
Sure. So kidney disease is a disease, unfortunately, of Hispanics, African Americans, and underserved communities. So we are at increased risk for many reasons. One of the reasons is because we also are more likely to have diabetes and hypertension. So that puts us at increased risk also for kidney disease. So if you feel you're at risk, if you have a family history, et cetera, you have diabetes or hypertension yourself, then you should screen annually and make sure that as soon as it's diagnosed, that you start treatment too, so that you can avoid dialysis and transplant.
Okay. Are there certain things that we can know ahead of time that something's wrong?
Unfortunately, the kidney disease does not have any symptoms. The symptoms appear very late, and therefore that's why screening is so important. Because to be honest, 4 out of 10 people in the United States that start dialysis, they only found out in the emergency room. They had no other symptoms. So that's why screening is so important.
Oh, bummer. Okay, well, thank goodness at least we have that. What does the National Kidney Foundation do, and how can people get involved?
So sure, the National Kidney Foundation is a patient-centered organization that is raising awareness of kidney disease, trying to prevent kidney disease, and then making sure that all patients are able to afford and undergo treatment. We are doing things like a screening test or raising funds for research. So that's what the Kidney Foundation does. And if you want to learn more about it, please visit thekidney.org, which is our website. You have patient information, nutritional information, information about different types of kidney diseases, stages, things like that. So it's very patient friendly and easy to manage.
Wonderful. Dr. Rosas, thank you so much for all this information. We appreciate it.
Thank you, and happy Kidney Month.